Hi everyone, my name is Shanae. I work in implementation at Awardco, and today we are joined by the wonderful Madeline Quinn from Children's Hospital and Medical Center in Omaha, Nebraska. Madeline, thank you so much for joining us. I have so many questions for you, but I want to start with a little intro. Tell us more about your background and what Children's is as an organization.
Yeah, Shanae, it's wonderful to be here with you again. I really cherish the time we had in implementation together, so I'm so excited to talk more. Like you said, my name is Madeline Quinn. I work at Children's Hospital and Medical Center in Omaha, Nebraska. We have around 4,000 employees, and our mission at Children's is to improve the life of every child. My role here is unique. It's a new role in healthcare and at our hospital. It is devoted to the well-being of our healthcare providers because we truly believe that if we focus on joy, recognition, and caring for our providers, then that's how we improve the life of every child so we can be our best selves at work. I have a clinical background by nature. I am a nurse, and I have been at Children's in the pediatric intensive care unit for the past 10 years before joining this well-being role.
Maybe tell us a little bit about what challenges you guys were facing at Children's that pushed you to look for an employee recognition solution like Awardco.
Yeah, so what I loved most about our implementation with Awardco is that we were able to work together to be mindful about when we implemented. So we implemented after our employee engagement survey because we really wanted good baseline data of what our employees felt like for recognition. We had purposeful questions, and so we had that before we launched so we could really see the effect of recognition and see that it was needed. I am proud to say that our scores for recognition before launch were really low. And so what that shows is that anyone who doubted that we needed a solution like recognition and a solution like Awardco showed that our staff were asking for more recognition. They didn't feel recognized for the hard work they were doing and for saving lives of children every day. And so I was so excited that we were already working on a solution so that we could respond to the needs of our employees here at Children's.
Yeah, so can you go into that a little bit more? What stood out between Awardco and other vendors that you guys looked into? I know you said redemption options and branding, but was there anything else in particular?
Yeah, I really felt like you took the opportunity to learn what we were looking for as far as solutions, and were mindful of offering opportunities and suggestions to enhance it and make it personalized to us at Children's. And I really felt like this was the platform choice that could allow the most customization. And so I felt like we could really, make it unique for our healthcare organization. And then also I was looking for best practices. So what do other companies that have high engagement scores and retention use at their organization? And that's how I found Awardco, was through researching what other organizations in and without healthcare had for recognition potential.
That's awesome. My next question would be, what's the proudest moment that you've had since implementing Awardco that Awardco helps you achieve?
Yeah, so I would say the two proudest moments that I've seen since implementation is one, we are capturing the small moments that are occurring on a daily basis throughout the organization that we might not have never known had happened. And so when you look through our feed, you see the doctor who recognized the environmental staff worker who helped direct them to a classroom because they didn't know where they were going and they were late for a training event. And so you're really seeing just those little kindness moments that are existing. And then now we're taking it a step further and allowing recognition for people just being their best selves. And so I think that's really beautiful to see all these small acts of love that are occurring about. And now not only do everyone at the organization has the opportunity to see those on our feed, but their leader is seeing it. All of our administration team is seeing it. And so we can really recognize all of our team members for the passions and skills they bring each day. The second most meaningful thing is that we obviously ask our patients for feedback and responses. And one thing that we implemented with Awardco was that we talked with our corporate compliance and made sure that we were following all privacy regulations, but we de-identified patient experience stories that never got back to the providers before, and we're able to share these on the platform. And so some stories say like, this doctor saved my son's life, and just even thinking about the fact that that provider never saw these comments before, and it allows us to reconnect to the meaning of what we're doing, and we're able to share these stories that were never there before, and that is so beautiful and so meaningful for our healthcare providers.
I love working in implementation and launching a client because I can go in afterwards, look at the feed just to see how much engagement is happening right off the bat. And children's was by far one of the most fulfilling because just crazy amounts of recognitions from the bat about exactly what you said, those little acts of kindness or teamwork that you just wouldn't hear about otherwise. All right, Madeline, which recognition programs does Children's use to drive their values forward?
Yeah, so we spent the largest part of our budget on peer-to-peer and leader-to-peer recognition, and we call that Send Sunshine. That's the name of our platform and that program. So we give our team members points each month, and then our leaders points over the course of a year to recognize one another, because we know research shows that peer-to-peer, leader-to-peer, and then patient recognition are what is most impactful in healthcare organizations. And so with all of those recognitions, you have to tag one of the values that the person exemplified in that recognition moment. So it's really creating that tangible opportunity of what are behaviors at Children's you're exemplifying and the acts that you're doing. So we have 5 values for our staff. They're innovation, collaboration, accountability, respect, and excellence. And so the team member writes the comment, and then they select the value that that person exemplified in that action. And I think it's really the first time that we've really created some concrete examples to what the behaviors mean. I love it for the team member because you're able to see right on your dashboard, like what values you exemplify the most, and you can use those in your annual performance evals to show your leader what you're doing to live out the values at the organization. We can report it and track it on the back end, so we can recognize employees that are recognized most for excellence and celebrate them for doing that over the course of the year. And then I've also been trying to train leaders that they can use the reporting features to see in the last 2 weeks before their staff meeting, our team has gone above and beyond in excellence. Thanks for doing it. Here's 3 comments that are centered around excellence. So just remembering that recognition programs tied to values are scientifically shown to be in the strongest. And then how do we make it easy for team members to constantly interact with our values?
All right, quick follow-up to that one. What has been the impact of 1 or 2 of those programs that you just mentioned?
Yeah, I would say the most tangible example from the impact of the program, and I'm going to go back to the patient experience one. Research, once again, I look back at this and subconsciously, we start to exemplify the behaviors more if we're recognized for them. So if we're recognizing our healthcare providers for being a good listener of a patient, or the mom said, you really listened to my son, or you really looked at my son in the eye and really talked to him, then we just know that by like psychology research that then that behavior is going to continue more. And so I can't even begin to think about the impact this will have not only on our patient experience, but also on our patient safety, because I know that if we're recognizing for being the excellent providers that we have here, that that's only going to continue to improve and make our patients safer and feel comfortable coming to the hospital as well when it's a scary experience.
All right, Madeline, I would love to hear, what are you most excited about for your future with Awardco?
I'm excited about enhancement opportunities. I feel like I've had a lot of team members at Children's come to me with ideas of how we could use the platform more, or other examples. And I have a wonderful rep that I work with now, Paige, who is able to take this back to her team to see what's possible. And so I just feel like if we're able to have some of these changes come about, then the possibilities are endless. Obviously, I think it would be cool to be able to have, some sort of profile type feature so we could learn more about each of our team members at Children's or know how they like to receive recognition so that if they love kind words and actions, or maybe they want me to come to them in person and say thank you and give them a pat on the back. So I think just even tailoring recognition to be even more personalized and the potential there is what's really beautiful.
Madeline, that's so awesome. Thank you so much for joining us today. We cannot wait to continue to work with you in the future and build upon your incredible platform. So thank you again. It's been wonderful to talk to you.
Thank you, Shanae. It was all of your help and guidance along the way that really helped to make it such a successful program, and I really appreciate all that you and Paige have done for us at Children's.
It's been a privilege. Thanks, Madeline. We'll see you.
Bye.